This is your Pac-Man GP. Ladies and gentlemen, it is wonderful to be back after almost more than a year, I believe. I am back with a video of a wonderful invention that I would be presenting today. But before that, I want to tender my sincere apologies to the viewers who might be expecting me to upload something. A lot of action had been going on since the last 1 year, you can say. The entire length of 2025 had some hardcore action at my personal end, because of which I was unable to focus on my YouTube activities and the videos and shorts that I have been creating since 2024. But come 2026, I have definitely made a decision to be more regular, more consistent and disciplined on YouTube, and would definitely post more regularly than otherwise. So again, apologies to the viewers. Today, I am going to present an invention which is pertaining to the technology of disposal. And more particularly, it is pertaining to medical wastes, disposal management of medical wastes. So without wasting any further time, I'm going to present my screen. Just bear with me. And it's on your screen. So the title of today's invention is Chemical-Free Medical Waste Disposal Machine and a Method Thereof. So basically, it's a machine. It's an entire system that has been invented by our inventors. And of course, they have also claimed the method in which the waste has to be treated and has to be brought to a position where it can be disposed in a much more efficient manner. So this invention is more about a machine as a matter of an apparatus and a method that is executed on that machine. So that as you can see from the title of the invention, it is obvious that the waste disposal is pertaining to medical wastes. So before I move on, I'm just going to maybe talk in one slide about the kind of medical waste which are generally observed or which are sought to be treated before the medical equipments which are carrying those which are carrying the contaminants are expected to be disposed. I'll just go towards the bibliographic data first and foremost. The bibliographic data contains the patent number. The patent number is 533173, and the patent has been granted in the name of a Nagpur-based company in Maharashtra, in the state of Maharashtra, India. The name of the company is MOCBSZ Private Limited. So congratulations to this company. I believe they are active in the field of biomedical engineering. Before I move on, I just want to provide a small disclaimer. Whatever I am presenting here in this video is only for academic purposes, and I do not claim to render or to provide any kind of legal advice or patent-related advice through this channel or through this this particular video. So viewers can bear this in mind. Having said that, this video has been conceptualized, has been shot only for the purpose of creating a sense of awareness so that viewers and general public can come to know about the kind of inventions for which patents are generally granted. Predominantly, my focus would be the patents which are granted by the patent office in India, mainly because I am an Indian patent agent. So therefore, I would be more interested in presenting patents which are granted by the patent office in India. So having given those disclaimers, I would like to move on. The bibliographic data is on your screen, and this is readily available in the public domain. So there is definitely no breach of anybody's confidentiality or privacy So that is another thing which viewers can bear in their mind. Moving on, as I mentioned some time back, I would like to present on your screen certain certain category of medical waste which are sought to be sort of treated before they can be disposed in an effective manner. Some of the wastes are pathological waste, which contains pathogens and microorganisms. They can be in the form of sharps, your syringe needles, which are used to administer a drug within the body of a subject or a patient. You have your pharmaceutical waste, genotoxic waste, chemical waste, radioactive waste, and certain non-risk waste also. So these are the general category of medical waste which are observed in the healthcare industry at large, and which are sought to be sort of treated before they are disposed in a very effective and efficient manner. I move on to the next slide. So this slide provides a general flowchart of the methodology or the method or the process in which the medical waste is sought to be treated by the machine which has been invented by our inventors in a stepwise manner. At number 202, as you can, if you can just follow my pointer, at 202 you have the first step, followed by the second step at 204, then the third one at 206, so on and so forth. And on the next slide, we have the general layout of the machine for which the patent has been granted. Okay, so I will be moving in tandem back and forth. I will be explaining this particular invention for which the patent has been granted from a perspective of the methodology or the process or the method of treating treating the medical waste in a chemical-free manner. And I will be explaining it with the help of the system on which that method is executed through this diagram, which is on your screen right now. So the first step is loading into a utilization hopper device a medical waste. So in this figure at number 100, we have the machine. Okay, we have the machine, the entire machine here. At number 102, we have an inlet of a hopper which is at 104. Okay. Then at 106, we have a shredder. So it is a general shredding device which is capable of shredding the medical waste that is passing there through. And then at 108, we have a heating element with screw press. At 110, we have a boiler for steam. Okay, so it is a boiler which is supplying a steady flow of steam to the hopper for the purpose of sterilization. And finally at 112, we have a collection box with UV light. Okay, so this is the general layout of the system. I'll go back to the flow chart. So the first step is loading into a utilization hopper device a medical waste. So the medical waste which I have listed here. Now it can be any of these medical wastes. These medical wastes are sort of administered in the hopper through the inlet 102. The hopper is at number 104. This is the hopper. Okay. Now, while the medical waste is present in the hopper, it is subjected to the process of sterilization. Now, which brings us to the second step, sterilizing the medical waste to kill pathogens and infectious medical microorganisms present in the medical waste. Okay, so the sterilization is done with the help of the steady flow of steam that is provided by the boiler 110 to the hopper. So, the medical waste that is administered in the hopper, it is sterilized by the steam, okay, which is constantly flowing inside the hopper. Finally, after the process of sterilization, we have the step of cooling the sterilized medical waste to bring the sterilized medical waste to a safe temperature suitable for handling. Now, as we know, steam, it's a very hot media. Definitely, when the medical waste would be sterilized, its temperature is going to increase, and therefore it is not a temperature at which it can be handled by a person, a user, or the technician who is operating this particular machine. So therefore it has to be cooled down. So the cooling also takes place in the hopper device at 104. The next step is the step of shredding the cooled medical waste into smaller pieces in order to reduce an overall volume of the medical waste. So after the medical waste is cooled down, it is administered in this shredder, which is at 106, and it is shredded into small pieces so that the entire volume of the medical waste can become compact. It can be, the volume can be reduced so that, handling a smaller volume becomes much more easier. And then we come to the final step where the method, comprises the step of draining and screw pressing an excess liquid present in the shredded medical waste. Which means that after the shredding is done, shredding of the medical waste is complete. The shredded medical waste is administered to a screw press. So this press is more like a pressing device which sort of drains out all the liquid that may be present in the medical waste, and along with that, it is also sort of subjected to a little bit of heat so that any liquid content, any kind of water molecules which would be present in the medical waste can get evaporated. So that is what happens at 108, which is the heating element with screw press. And after it is dried, or the medical, it is devoid of any kind of a liquid or water, the medical waste is then sent to the collection box. Now the collection box is already administered with UV light, and the UV light is capable of destroying or breaking the DNA link of any microbial, any microorganisms or pathogens that may survive this entire process. So that is where the journey of the medical waste ends within this machine, and after that, the medical waste in a very sort of particulate and granular or a shredded form is ready for further disposal. So this is the general invention. And if you have liked today's presentation, please subscribe to my channel at the rate of PacmanGP. Please like, share, and comment. And please do send in your comments in the comment section so that I will get a very valuable feedback from your side. And don't forget to like, share, and subscribe and comment. Thank you very much. And this is your PacmanGP.